cursive?
Yeah.
Good. I'm gonna only write in cursive. Okay. I like to think I'm a very nice person, but like also no BS. So if nobody is participating, I will just end it and go back to my job. Okay, everybody. Y'all, see, the thing is you ever hear that preaching to the choir thing? You know what that means? Does anybody know what that means? The choir's obviously at church, and so they're obviously doing the right thing. Preaching to the choir means, actually, let me move this because it's blocking the camera. Hi. Okay, so we're still recording. Preaching to the choir is like if I sit here and lecture you guys about not participating and being late and not being here, that doesn't make sense because you're like here, right? So it's more for those that are on Zoom, and then even more for the people that are neither here or on Zoom, which ironically none of them can hear. Okay? I need participation, and I will remember, first of all, these faces, and then if nobody is participating, I will go back to my day job. Got it?
There's one more person in the waiting room.
Oh. Well, it's 12:07. Okay, so I'm going to let them in, but then I swear it's the last person I'm letting in. Because y'all got to be out of here at 1 because I have a patient. Okay. That's it. Now, getting back without further interruptions. If you answer a question and it's wrong, and it's the dumbest answer I ever heard in my life, is that still better than not saying anything? Yes. Okay. So, what are we learning about today?
Pathology.
Yes. Okay. And then people on Zoom. Didn't hear any of you say anything.
Yes.
I like yes, but we're learning about
Pathology.
I heard one person on Zoom say pathology. Great. Okay. Now, next. And this is for Zoom people only. Who knows what pathology is?
Is it like detecting diseases or like identifying them?
Yes, but when I can't see who's talking, so say your name first, and then you get 1,000,000 bonus points in my mind. So who was that?
Lavelle.
Lavelle! Yes, so I want somebody to be, I do this all the time. I ask my husband, who's not a doctor, is this a thing normal people know? Because I've been immersed in medicine for 20 plus years, and so I don't know what normal people know and what they don't. Is this something that people in general life know about, or is this something that I only know because I'm in medical school? So I need a what do normal people know translator. You're going to be it. So you're the only one permitted to be on your phone.
Okay.
I want the actual like Google definition of pathology. You're going to be the definitions guy. And what is your name again? I remember you came to the event and you participated because I remember your face.
Ishan.
Ishan.
Yeah.
You're going to tell me what just the internet says pathology is. Because, I mean, I know what it is and I know what I've been taught, but I don't know what... You guys, anybody watch Harry Potter, like Muggles? Like, what do the Muggles know? What do the Muggles think pathology is?
I don't have any internet.
You don't have any internet. Does anybody have access to the internet? Okay, somebody on Zoom is gonna have to be the what do normal Muggles
Oh,
know?
I have internet.
Okay.
Pathology is the study of disease encompassing its causes, mechanisms, and effects on the body.
Okay, that might be on the post-lecture test. So if anybody wanted to commit that to memory, that would probably be good. Okay, so now we all know what pathology is. Someone on Zoom, repeat that back to me because it's going to be on the test. And to make you go faster, I'll sing while we're waiting. Do 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 do. Guys, we literally just said the definition. I'm only asking you to repeat it. I'm not.
Pathology is the study of like diseases and its causes, mechanisms, and effects.
Yes, but who said that? I can't see.
Arian.
Aryan. Yes. That's right. Okay. Now that we've got one definition down, guys. Okay. So this is one of my favorite books from medical school. Are you zooming in?
Mm-hmm.
I'll make sure that you get from different angles to make it aesthetically pleasing for the YouTube. You know, you zoom in, you get the back of people's heads. You can zoom in on them furiously taking notes. You gotta make it like aesthetically pleasing. We have the fundamentals of
Pathology.
and Zoom people. We have
The fundamentals of pathology.
said by
Isha.
Isha. Very good. Okay, now we're gonna start at the very beginning, which is a very good place to start. Okay, so does anybody know what homeostasis is? Shout it out.
Like maintaining balance with your environment.
Right. It's the place that we want to be. And so we want to be in the place we want to be, and we don't want any stress or anything causing problems, right? But then we do, and this is where we get into some words with hyper. So what's the difference between hyper and hypo?
Hyper means it means like extra or like higher than the number,
Correct.
and then hypo is lower than what it should be, or like what the basis should
That's
be.
exactly right. 100%. Okay, so when you go to medical school, you basically learn Latin, which I think it's Latin, I don't really know. So you take apart the words, which is etymology, not to be confused with entomology. Okay, so you have hyperplasia and hypertrophy. So what do you guys think either one of those means? So all right. Actually, let's erase so that we have more room. You guys can think to yourselves. Hyperplasia. Okay. Hyperplasia, hypertrophy. Can anybody guess?
Hyper obviously means higher than the basis, but then trophy, I'm gonna like derive this from atrophy. It means like, I think it's like degeneration or something like that.
Did you already go to medical school?
No.
Are you sure? Okay, so we have the hyperplasia. We have gene activation, protein synthesis, and production of organelles. So lots of that going on, right? And so there's new cells from what kind of cells? Stem cells. So we have new cells. Hold on. I was gonna use my finger, like that would somehow erase it. You guys can't even read cursive, so I'll try to make it legible. Cells. Okay. So we have increased cells. So let's see. All right, so one good example of hyperplasia would be your uterus during pregnancy. Which, does it get bigger or smaller?
Bigger.
Okay, and then we have hyperplasia in an organ called the prostate. Does anybody know about a prostate?
Yeah.
So, what is it?
It's like, I don't know how to it's like one of the parts for the male reproductive system. It's just, I don't know how to explain. I reviewed it yesterday, I'm sorry, but like.
You're doing better than everybody else.
I have it in my notes, look, let me check this. One second. Okay. Actually, I don't have. It's like a gland. That's what it says. I think it's some sort of like reproductive gland for hormones.
Yes, and who has it?
The male.
Yes, the male. Okay, so if we have hyperplasia, we have increased cells from stem cells, and then we have hypertrophy, which is gene activation, protein synthesis, and production of organelles. Now, sometimes this is not good. I mean, it's okay if you're pregnant and it's your uterus. But sometimes it leads to things like fill in the blank. What's the thing where your cells are going crazy and making
Cancer.
Cancer, yes. Okay. So we don't really want that version of it, right? Okay. And then hyperplasia, increased cells, hypertrophy, gene protein and organelles and all that jazz. Okay? Now we have atrophy. I haven't heard a single peep from anybody on Zoom. What's atrophy? ATRO?
Is it muscle failure or weakness?
Yeah, so a decrease in the cell number. So if you don't exercise and your muscles get smaller, then that's muscle atrophy. And how do things atrophy? Like when the cell dies, does anybody know what the word is for when the cell dies? Programmed cell death. What's your name?
Ashley.
Ashley. What is it?
Apoptosis.
It's apoptosis. Okay, so we have. Let's see if I can just spell it on my own. And then I'm gonna do a different color. Let's see. I'm gonna do like red because the cell is dying. Oh my goodness. And then it gets so sad. Look at that, how sad the cell is, apoptosis. Okay, so now we have atrophy, we know apoptosis, and then we have, we're good. Some of this stuff is just like way, no offense, way beyond you, okay, so I'm gonna skip some of this stuff. Okay, and then we have someone on Zoom, interpret my cursive. I 100% will just hang up on all the Zoom people and only teach the people in this room if I do not hear you guys answer questions. Are they even there anymore?
Dysplasia.
Okay, thank you. Yes, it's dysplasia, which is, so I'm going to write in regular because it sounds like I'm throwing everybody off. Okay. Oh, I started writing in cursive halfway through. It's so hard. Okay, now somebody on Zoom tell me the definition of dysplasia.
Disordered cell growth.
I didn't hear any names, but I heard disordered cell growth. Okay. What happens if your dysplasia gets worse and worse and worse? You guys know, someone on Zoom.
Cancer.
That's right. So do we want the cells to start doing crazy stuff like this? Okay, very good. Whew. Okay, so let's show an example of one of these that's real good. Is where'd the interwebs go? So I like this is for later. Barrett's esophagus is an example. See? We have dysplasia right here. Does anybody know what we're looking at? These are samples that you put on a slide and put under a microscope. Does that kind of help you visualize what's going on here? So we have a thing called Barrett's esophagus, which is a disease related to,
Esophagus.
well, yes, but also related to dysplasia. And look, it even says pathology right here. How do you like that? Okay, so let's see. This, well, I know maybe the Zoom people can't see, but the portion up top is with a camera. Does anybody know how they take these pictures with a camera inside of your esophagus?
Like a small, narrow.
Correctamungo, and what is the word for that? An endoscopy. So you have an endoscopy. They usually put you to sleep because, you know, you don't want a camera down your throat and be awake. You probably like hit them. And then they take pictures of the inside of your esophagus. Ah! Ah! And then it looks like that. How do I get back? Oh my gosh. No. Anyway, so they take pictures of the inside of your esophagus. Why would the back button not work? Does anybody know? Maybe it's over here. So anyway, I wish I could circle this. So they have the camera, they go in, but how do you get those purple pictures that you put on the slide and then put under the microscope?
Stain them, yeah.
Correct, but what's that called?
Gram stain.
Well, yes, it is gram staining, but all right, so you go in up here with your camera, and then you take a little sample, and then you send it to the pathologist, and then they gram stain it, and then you can see it on the microscope. But there's a word, and it starts with a B.
Biopsy.
Yes, who said that?
Delia.
Amazing! It is a biopsy. So this would be, you go in, you take the sample, you biopsy it, and then if you see dysplasia in the, what organ?
Esophagus.
And then it is called,
Cancer.
almost,
Barrett.
Barrett's. Yes, Barrett's esophagus. Okay, you don't want to have Barrett's esophagus. You don't want it. Okay. Whew. Now let's see. Does anybody know? Okay, so we're gonna talk about cellular injury a little bit. You don't want your cells to get injured. I'm gonna let you know that now. And so what? I like kind of expect you to read my mind. What is a big cellular injury? Okay, let me back up. What's something your cells need? And we all need. We're breathing it right now.
Oxygen.
Yes, oxygen. And so one of the biggest cellular injuries is going to be a lack of,
Oxygen.
and there's a name for that.
Does it start with the H?
It does.
Hypoxia?
This is the H lecture. There's a lot.
Hypoxia?
Yes, it's hypoxia. Okay, so hypoxia would be lots of oxygen or a little bit of oxygen.
Little.
A little bit of oxygen.
Yes, who said that?
Lavelle.
Lavelle, 1 million bonus points. Okay, now, what a little bit of oxygen is going to lead to, do you guys remember what ATP is?
Yeah.
Oh my goodness, it's back! ATP is back, baby! Okay, and what would that lead to?
Energy.
What about low? It would be low energy. So, if we have hypoxia, that is low oxygen, which leads to low ATP, which is low energy, which leads to tissue injury. Now, when you're studying to become a doctor, one of the biggest things that they teach you about is tissue injury. And they will circle it like this. Okay. So do we want tissue injury or do we not want tissue? Okay. Okay, I'm glad that we're all on the same page here. All right. Okay, so let's recap. Someone from Zoom, what is the word for low oxygen? to your cells and tissues?
Hypoxia.
Hypoxia.
Amazing. Okay. And then hypoxia leads to low. I know you guys know this. Low. It was just on the board.
ATP.
Correct. And low ATP leads to?
Tissue damage.
Yes. That's exactly right. Okay. And then, so how does so we'll just do the esophagus. I'll draw the stomach just so you, let's just work with me here. So we have the esophagus here, right? And that was what we were looking at. I'll draw the pyloric sphincter for you, just so it makes more sense. So we have our esophagus, and we looked at what if we have the dysplasia, we get the Barrett's esophagus, and then it gets out of control, and then it leads to cancer, esophageal cancer, right? So I just wanted to draw an organ here. So the organ that I used was the esophagus because it is fresh in our minds. All right. If we have, I was going to use the color, it would have been obvious. How are we getting oxygen to our esophageal tissue?
When you breathe in through your nose, it goes down.
It
your
does.
esophagus.
Well, yeah, technically, I guess that's true, but that's not where I'm going here.
Is it like the blood vessel?
Yes, because I was about to go to red, and then I feel like that would have been too obvious. So you have blood vessels, and here we have some blood vessels. And then what do we have here? What is this guy? Anybody on Zoom?
Oh, red.
Yes, red blood cell. Who said that? All right, you graduated. You get your diploma early. Yeah, it's a red blood cell. And what is on the red blood cell that we're taking to the esophagus? Yes. Okay, so we have oxygen. Look at all this oxygen, right? Okay, so let's say something weird is happening and it's impeding this. What's going to happen to the esophagus?
It's not gonna get its oxygen.
Yes, and there is a word for it. Well, hypoxia. But when the tissue, yes, it is hypoxia. But there's another word that I want you guys to know. Ischemia. Yes. Write it down. Write it down. Ischemia. Okay, so we have ischemia. Is that good or bad?
Bad.
It's very bad. So you're impeding your red blood cells' ability to get to the tissue, and therefore the tissue can't be oxygenated, and then the tissue becomes ischemic, and then what will inevitably happen to that tissue?
It'll
Die.
die.
R.I.P. Correct. Okay. So there's another thing that has multiple definitions, and I do believe that muggles have, I left the E there. Muggles know about it, but I think muggles have a different definition. Shock. So does somebody from Zoom want to tell me what shock is? There's a medical term, there's a non-medical term. I'll take either. This episode is brought to you by C4 Energy Drink. Zoom people, wake up.
Isn't it like a life-threatening condition where there's like not enough blood meeting like the body's needs and stuff?
Yeah, and why? What's the word for when there's not enough blood or your blood pressure is really low? I'm writing it real slow.
Say hypervolemia.
It would be hypovolemia. Hypovolemia is low blood volume. You would
Okay.
have that if you're bleeding out somewhere, which would actually lead to this.
Okay.
But I'm writing. Who said it from Zoom? I need names.
Isha, hypotension.
Yes. Hypotension. And hypotension is low blood pressure. So if we have low blood pressure, and I'm not talking like, not even like 90/60, because like that was my blood pressure when I was pregnant and I didn't go into shock. But I'm talking like 70/50. It gets to a point where it's so low that your blood is not getting to all your organs and you're having like tissue damage due to ischemia, right? And so that leads to shock. And shock is life-threatening, as who said it was life-threatening? Do you remember? What was the name of the person that said it was life-threatening?
Karen.
Well, you're right, it is life-threatening because it leads to poor tissue perfusion. Okay, so shock would be you're so surprised and you're like, and back in the olden days they would say people died of shock. People do die of shock, but not, well, okay, if you get surprised and you have a heart attack, fine. But when you work in a hospital, shock is like you are so poorly perfused that your organs are all dying because they're not getting oxygen, okay? So that would be a shock. Okay, so, woo. Nah, I'm wooing because some of this stuff I'm like, a little bit, no offense, a little bit too much. Okay, so besides, one of the main things that would cause you to have like really low blood pressures, is like you're bleeding out everywhere, you're losing lots of blood, obviously. You wouldn't have enough blood to perfuse your organs and that would lead to shock. But there are other things that cause poor tissue perfusion. And I guess I wouldn't expect you to know, so maybe I'll just tell you, is that anemia. Has anybody ever heard of anemia?
Is it low iron?
Yeah, there are so many different types of anemia. And I like to throw out random bonus points. This is over at 1. So the first person to email me all the different types of anemia at 1 gets 5 bonus points. Okay, there are so many types of, there's like anemia of chronic disease, iron deficiency anemia, and then there's like types and then subtypes. There's microcytic anemia, macrocytic anemia, there's a bunch. And so if your red blood cells that I drew earlier, right, they kind of look like this, right? And they have the O2. If they're not able to carry the oxygen, that's another way that your tissues might not get perfused and not get oxygen. So if you have anemia, any of them, okay? So there's another one that would, what is that thing? You have a monitor in your house and it's not a smoke alarm, but it is a
Carbon monoxide.
yes, a carbon monoxide detector. You get carbon monoxide poisoning, you're gonna have not enough oxygen, and then you could also get the tissue death that way. Okay, so there's just so many fun ways that you can get poorly perfused. Okay, and so let's see. Let's find some like really fun diseases here. So necrosis. Does anybody know about necrosis?
Is that like tissue death?
Yeah. So you see a theme here? Let me. So we have necrosis. You got your death of the large group of cells, okay? And so, let's see what I want to talk about. Do you have, Well, I think you guys might be interested in some pictures, because we all like to shock and make you guys remember stuff, okay? So, there's different kinds of necrosis. So we'll do a 1, and then we'll do A. So we have coagulative, I feel like there's an I. And that's, I can't believe thinking my finger is gonna somehow erase this, like magic. We know it's necrosis, so coagulative, right? And then we have liquefactive, which was the one I was looking up earlier. Liquefactive. Gangrenous, has anybody seen gangrene or perhaps smelled it? Has anybody heard of gangrene?
Yeah.
And then Cassius. Okay. Which Cassius is a combination of coagulative and liquefactive. I'll do a different color. I feel like that's confusing. All right. And so, let's try to. Let's just see if there's like all of them. Well, this doesn't have the pictures. So we have liquefactive. What do you think what is a word that's in liquefactive that might be pertinent?
Liquid.
Liquid, yes. So the cells, the dead cells, they liquefy, okay? And then we have coagulative. So they maintain their structure. We have a denaturing of proteins. We have fat necrosis, which is actually if you get punched in the breast, you could get fat necrosis. Cassius necrosis, that's if you're taking a board exam and you see the word cheesy, that's that one. I think the word is like pathognomonic. So if you see a certain phrase like cheesy, it's associated with Cassius necrosis. Pathognomonic just means you associate the two together. And then, I don't have infarction necrosis here, but that's the hypoxia that we talked about a lot. But what I want pictures. Oh, great, we're getting on Facebook now. That's not what I meant at all. Well, those are horrible pictures. Oh, here's a picture of cottage cheese. That's great. The cottage cheese would be which one? Yes. Why are these like images so blurry? Okay, so let's see. Oh my gosh, yes. So you guys can take a look. This is. Do you even know what body part this one is for the? Yeah, this is what dry gangrene looks like. Okay. How do you like that? All right. And how does one get dry gangrene? I'll give you an example of, I see it all the time. What do you guys know about diabetic people's feet?
I heard that you have to be very careful when it
You
comes to-
do?
Yeah.
Well, they can't feel them usually.
Oh.
They're going to be poorly perfused, so they're not going to get oxygen. And then what happens when an organ or tissue or whatever doesn't get oxygen? Yes, so people with diabetes will have poor perfusion in their feet a lot so that the tissue dies and then they get gangrene that way. And then what do you do? Okay, Zoom people. If you're a doctor, somebody has really bad gangrene in their foot, what do you have to do?
Do they usually amputate it?
Yes, amputate. So then we have the fat necrosis, like I said. The breast and the pancreas gets that one. And speaking of, here's a picture of this is fat necrosis in the pancreas, right here. Alright. So, these are some diseases and problems that can happen when you're not getting enough. I wonder what this one is. This looks like, I don't know, I don't want to click on it, it'll take me to Facebook. Ooh, look at those toes. That's an interesting one. Alright, so, just to recap, what are the different types of necrosis? Nobody remembers? I'll bring them back up. Will do. People on Zoom, what are the different types of necrosis? Is nobody on Zoom?
Coagulative necrosis, liquefactive necrosis, gangrenous necrosis, caseous necrosis, fat necrosis, and fraction necrosis.
Yes. Fibrinoid necrosis. Yes, those are all the different types. Okay, so let me see. We can get into inflammation. What does anybody know about inflammation?
When something like swells up.
Swells up with,
Blood vessels.
well, it's something called neutrophils. Does anybody know about neutrophils? No, that's okay. They don't know about you either. Alright. Inflammation. Okay, so swells has neutrophils. Okay. What is it usually in response to? I'll give you a hint. It's something, there's a couple things, but a hint is, it's something that we just talked about. Injury? Necrosis in particular. So you get your necrosis and then you get your inflammation. But what could also cause inflammation? Zoom people.
Irritation.
Yes, irritation, infection, any sort of annoying thing going on. Alright, so has anybody ever seen any like swollen legs, swollen lymph nodes, any swelling? So you guys know what I'm talking about, right? Yeah. And there's a word for if your legs are swollen, and like you can press on it and it makes an indentation. It's called edema, and then the indentation, it would be pitting edema, like it makes a pit. So sometimes people's, if they have heart failure, their blood pools, and where would gravity pull your blood to? To your feet and your legs. And so it swells up, and so you push on it, and then it would make an indent, and that's called pitting edema. And so there are, alright, inflammation, some of the signs. Alright, if you like get a cut and it gets infected, what's something that you would expect it to do? What color would you?
Green.
That's really bad off. Okay. It turns what color? If you get an infection and it turns red, okay. Called rubor. And then another thing we have, so the swelling is something called, and it's not the tumor, it's a different tumor. And then if you get a cut and it gets infected, what's another thing that, a characteristic of it, very unenjoyable characteristic.
Pus or like.
Well, it could be.
Okay.
But like if you get a cut and it gets infected, what is going to be a part of that process that you're not going to enjoy?
Pain?
Yes, pain. Who said pain?
Isha?
Isha. Pain. Pain. And that is, who speaks Espanol? Dolor. Okay. And then there's one more. You get a cut. You get an infection. You have your swelling, and then the swelling is because you got your neutrophils. Okay, so you have your swelling. You have, it's turning red. Your cut is turning red. Oh my goodness, it's starting to hurt. And then what is another sign? It's like, you just please go to the emergency room. Number 4.
You lose function.
Well, you will. But this is a sign that like you guys can notice yourselves at home using a thermometer.
You have a temperature?
You have a fever. Okay. So, people on Zoom, you have a cut and it's getting infected. What are the 4 things that are going to happen? I'll give you a hint. They're written literally right on the screen.
Swelling, it turns red, there's pain, and you have a fever.
Correct. Who said that?
Isha.
Isha, you're right. So when you're a doctor and you do like a surgery and your patient calls and they say that the scar from the surgery is red and it hurts and they have a fever and it's starting to swell, are you going to say, yes, that's to be expected, enjoy? Or are you going to say, no, you need to come in, I need to take a look at that? Which one are you going to do?
Come in and take a look.
Correct. See, you guys are already doctors. Look at that. Okay. And let's see, has anybody ever had a cut that got any 1, 2, 3, or 4 of these? Anybody on Zoom? Nobody have ever had like a piercing that got infected or anything?
Oh, actually, yeah.
Okay, so did the piercing that got infected, did it feel good?
No.
No. Okay. I want to see if my 1 p.m. patient is here. Do you want to, somebody take over the recording and you go check the camera, okay? Yes, I like that. Okay, so anybody on Zoom ever get like a piercing that got infected?
I'm getting a fever from a bug bite.
Well, that sounds awful. What bug was it?
Mosquito.
Ugh, I hate mosquitoes. Alright, so you see how these things kind of come into play and there's signs that stuff is not going as planned? Okay, let's see. I want to end on something like real interesting. Angioedema. Let me show a picture. This is a really bad reaction to like certain drugs or like allergies or like an allergic problem. You see how this kid's like face is swelling. So anaphylaxis, does anybody know anything? What is it?
Like a severe allergic reaction.
You should teach the class. Anybody else?
Yeah, it's when you
Virtual.
It's virtual? Okay. But there was nobody at the door? Oh, okay, I was hallucinating. So, when anaphylaxis, it's really bad, it can kill you. It's like, say people have allergies, it's like you get a little sick or you feel ill, but anaphylaxis is like, could potentially kill you. And bonus points for Zoom, people. Does anybody know that thing that you inject when you have an anaphylactic reaction to something like peanuts or whatever it is that you're allergic to?
Epinephrine.
Epinephrine is the correct answer. Who said it?
Isha.
Isha. Wow, is there anybody on Zoom besides Isha? Let's take a look. What's going on here? Who's even here? Oh, somebody's in the waiting room. Oh, snooze, you lose. Okay. Let's see. Oh, some of you guys have your cameras on. That's real nice. Okay. Alright, so. Let's recap. You have an anaphylactic reaction. Someone who has not answered anything yet, please tell me what you take to make it go away. Hint, we said it 3 minutes ago. All right, guys, for those of you who are here, why is it that not a single person on Zoom could answer that, but every single person in this room knew? I feel like there's some kind of physical, like, if you're more than 15 feet away from me, the information is just not getting that far. Everybody in this room, I feel like, has learned a lot and can repeat it back. But there's like all these people on Zoom that we just set up an effort 3 minutes ago. Okay, so when you have the anaphylactic reaction and what is going on in your throat and your eyes get, well, I was about to say the word.
Inflammation.
Yes, inflammation. You get puffy. And what is the bad thing that will happen if your throat swells up?
It closes.
Closes up the
And then if your throat closes, then what happens?
You can't breathe.
And then if you can't breathe, then what happens?
Low oxygen.
And then you have low oxygen, then what happens?
Low tissue
L-
perfusion.
Yes, and then what's the word that starts with I?
Ischemia.
Ischemia. And then what does ischemia lead to?
Tissue.
Tissue death, and then what happens to you?
You die.
You guys have followed the pathway the whole way through. Give yourself a round of applause. Yes, yes, everybody did very good. So in the end, do we want to prevent tissue death? And then as a healthcare provider, do you want to prevent most deaths? Yes. So making sure people have oxygen, they're able to breathe, they're perfused, they're not bleeding out everywhere, they have enough blood pressure for the red blood cells with the oxygen to get to the tissues to continue living. That is the aim of medicine. Ladies and gentlemen, do you feel like you've learned something today?
Yes.
Are you going to go home and breathe really good and get all the wonderful, glorious O2 out of the air and into your tissues? Very good. Okay, well, I think everybody that showed up gets, well, an A plus. And then some of you on Zoom get a B.